Pregnancy can be a magnificent time for many families and parents, and there are remarkable changes that occur in your body during pregnancy. Your body makes extra blood, and your heart pumps faster, working harder to provide for the baby. And there are some things that aren't very pleasant, tremendous hormonal changes, which cause everything from breast tenderness to morning sickness. But there's one change that's very frequent, and it's often unrecognized, and if it isn't identified, can have devastating consequences for mom and baby. That's gestational diabetes, and that's what today's video is about. Today I'm going to teach you what is gestational diabetes, why is it so important that you get evaluated for it, what are some of the simple tests to identify it, and then a little bit about the treatment. Hi, I'm Dr. Brian. Gestational diabetes occurs when a woman without diabetes develops high blood sugar while being pregnant. Now, it typically develops between the 24th and the 28th week of pregnancy, and occasionally even a little bit earlier. This raised blood sugar level is associated with catastrophic results for mom and baby, even though it's only present for a few months. What is gestational diabetes? Your carbohydrates are broken down into sugars, and specifically glucose. Glucose is the major energy source for all of the cells in your body. But glucose can't enter the cells on its own. To do so, it requires assistance from a helper, a hormone known as insulin. And this is produced by the pancreas. Insulin induces the cells to take up glucose. Insulin effectively unlocks the door so that the cell can take glucose in. Now, diabetes happens when insulin is either deficient or not used effectively by the cells. Without insulin, glucose cannot enter the cells. It stays in the blood, causing high blood sugar levels. So why does this happen in pregnancy? During pregnancy, there's a fascinating development. It's development of the placenta. The placenta is a special organ that provides all the communication between mom and baby. It supplies the baby with nutrients, oxygen, and it also produces a number of hormones. Now, these hormones are really to maintain pregnancy and help build the baby, but some of these hormones impair the action of insulin, making it less effective. This insulin counter-effective activity begins about 20 to 24 weeks, but it becomes especially prominent in the last couple months of pregnancy. Usually the pancreas is able to adjust by producing more insulin, but in some cases, the amount of placental hormones are so strong that it overwhelms the pancreas, and the pancreas cannot compensate, or the cells just don't react appropriately. This is how gestational diabetes develops. Any woman can develop gestational diabetes, but there are a number of things that put you at higher risk if you're mom. Age is an important risk factor. Gestational diabetes affects 1% of people under 20 years old and 15% if you're over 40. There's other risks, including if you have a family history of diabetes, you've had a previous history of gestational diabetes, if you're overweight, you have polycystic ovary syndrome, or if you've given birth to a really big baby in the past. In particular, if a previous baby weighed over 9 pounds, and if you're a smoker, that gives you a much higher risk of gestational diabetes. African American, Native American, Asian, and Hispanic moms are also at increased risk for gestational diabetes. The good news is that in 90% of cases, gestational diabetes resolves after the baby is born. If it's not treated, though, even after birth, there are significant risks to both the mother and the babies, in particular in developing type 2 diabetes. And it makes the baby much more likely to be obese as a child and as an adult. And for mom, there's depression, the risk of a C-section, and development of what's known as preeclampsia. This is a type of hypertension that develops late in the pregnancy and can also really be a risk for baby. Now, if gestational diabetes is poorly treated, babies are at a high risk of being too large. This is known as macrosomia. This may require a C-section, and it makes it much harder to pass through the birth canal. Birth trauma can result. Once the baby is born, babies that are born in the condition of gestational diabetes are at much more risk for having respiratory distress, which is where their lungs don't work very well, and they may even have to have a breathing tube to help them. In addition, because the baby is born in a condition of very high insulin levels, when the baby's born and separates from the mom, his or her glucose levels can actually drop really low. This can give the baby seizures. Lastly, and catastrophically, untreated gestational diabetes has an increased risk of stillbirth. Keep in mind, all of these consequences will happen even if you have no idea you have gestational diabetes. Again, it can be completely silent. And that's why, from a health perspective, it's vital for you to see your doctor and be screened. If your risk factors are low, your doctors will likely screen you for the condition when you're 24th or 28th week of pregnancy. If you're at high risk, your doctor may even test you earlier, even at the first prenatal visit. The test is fairly simple. It requires drinking sugar and then testing your blood. There's an initial test where they give you a sugar solution, a syrup, and then test your blood 1 hour later. If you pass that, you're done. If you have an elevated level of sugar after that initial screening test, then they'll do a second test. This test gives you even higher concentrations of a glucose syrup, a sugar water. And then they test your blood at 1, 2, and 3 hours after you drink that sugar. Looking at those levels will then predict whether you truly have gestational diabetes or not. Well, once you go through this simple test, and if you're diagnosed with gestational diabetes, then what? Well, it's really important to keep the baby healthy, that there is extensive monitoring that is done. And you have to control your blood sugar. It's highly important to avoid the complications that I mentioned earlier, both during pregnancy and during delivery. Your baby's growth and development will be very closely monitored with ultrasound and watched especially after 32 weeks. If you're mom and you've been diagnosed with gestational diabetes, you really have to work hard at doing a healthy diet that focuses on fruits, vegetables, whole grains. That's the best way to control gestational diabetes. Highly refined carbohydrates like sweets and candies and soda drinks, they have to be avoided. And as a mom, it's important to try not to gain too much weight, because a lot of extra adipose can actually cause increased insulin resistance. And regular exercise lowers blood sugar because it makes cells much more likely to be able to pull in glucose from the blood. For a select group of moms, they may require insulin injection just during the time period of the pregnancy if all other options fail. That's gestational diabetes. Keep in mind, gestational diabetes is really just a special type of type 2 diabetes. And if you're interested in more information about that, try this video, and thanks for watching.